Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
Hi, my name is Jaff. I'm a trainee echocardiographer and I work at Great Ormond Street. An echocardiographer does an ultrasound of the heart and allows us to look at the structure and the function of the heart. So we have patients that come from all over the world with various types of congenital heart diseases. So I started with a sports science degree in university, and when I graduated, that was pretty much the year that COVID took place. And then finding a job in sports was really hard because the world was pretty much on lockdown. So I used that as a great opportunity to kind of work on wards. So I was working in intensive care units, providing care and treatment to patients with COVID. And that's where I kind of got my first-hand experience in healthcare. And I was seeing doctors and nurses and physiologists using echo machines and ECGs, and I really took an interest into it. And that kind of pushed me to want to kind of further my knowledge within cardiology. So I picked up a master's in cardiology. Once I finished my master's, I was able to work within the cardiac departments of various hospitals. And then that's how I ended up where I am here today. So I'm 6 months into my position at the moment. And there isn't really a duration of how long it is. It's just kind of training me up, and when they feel that I'm able and ready to kind of sit the exam and be a accredited echocardiographer, then they will do so. The best part about my job is working with patients, working with children. I get to meet children from all over the world. I meet families from all over the world. And most importantly, making the difference in the world. The advice I would have given myself to the 16-year-old Jaff would have been to apply onto the STP program, and that kind of gives you the first-hand experience into working within healthcare as well as developing your expertise in cardiology. So when a patient enters the room, the first thing I do is introduce myself, so the patient knows exactly who I am, and so I'm able to build a rapport with the patient. We then offer patients a gown where they can put on before they lie down and before we begin the exam for the ultrasound. So once the patient's lying down, we then attach electrodes onto the patient. But before doing that, I ensure that the patient is in a calm manner. So we also have televisions in our room, so we can also put them on if a child wants to watch the TV while doing the scan. I always let the children know that this is a very safe procedure. So once we have the electrodes on, we then apply a small bit of gel onto our probe, and that probe is then placed onto the patient's chest, and it's rubbed around in several areas along the chest. And then on the screen, that allows us to see visually as the probe reflects the structures of the heart onto the screen. Once we've applied the gel and placed it onto the chest, the probe emits high frequencies and into the heart, and it basically reflects and allows us to see structures of the heart onto a screen. So with the ultrasound, it allows us to look at the entire structure of the heart, as well as allows us to quantify the function of the heart also. So we normally go through a systemic analysis of the heart, so from blood entering into the heart to blood leaving the heart. So that allows us to assess the veins, the structures in the heart, such as the valves, and then also the great arteries as blood is pumping out of the heart. So on the screen, we're able to see structures of the heart, so that would be the atriums, the ventricles, and also the great arteries such as the aorta and the pulmonary artery. We're also able to quantify and see how fast blood is traveling across valves and across certain structures of the heart. So on the screen, you may see blue and red colors, and that basically lets us know which direction blood is traveling. So systemically, you have blood traveling from the atrium into the ventricle, so you'll normally see red flow. So red normally means towards the probe and blue means away from the probe. We also are able to do kind of Doppler measurements, and that basically lets us measure exactly the velocity at how fast blood is traveling in and out of the heart. So we also place electrodes onto the heart, and that also allows us just to see how fast the heart is traveling. And it also lets us see exactly when the cardiac cycle of the heart is happening, as we need to do certain measurements during systole and diastole also. So systole is when the heart is contracting, so that's when the heart is ejecting blood out of the heart, and diastole is when the blood is filling, so when the heart's relaxed and blood is being filled into the ventricles. Very last image, we have an image called the suprasternal, where we have patients laying down flat on their back, and then we ask them to kind of arch their chin as high as they can, and then I place a probe just beneath their chin, just where the start of their neck is. and that allows us to see how blood is travelling out from the great artery, the aorta. It allows us to see how blood is travelling out of the aorta and the speed at which it is travelling towards the rest of the body. I really enjoy learning just about how the heart functions, different pathologies, as well as the patient interaction that I get working with children, as well as making a difference in the world.